Well, the holiday season is here, but it comes with the viruses like the flu, which continue to spread. And millions of Americans will be gathering this year with friends and family to celebrate the holidays.
And 22 News reporter Kiara Smith has what you need to know to protect yourself from getting sick.
Ciara, Nick, if you haven't gotten vaccinated for COVID, RSV, or the flu, medical experts say now's the time.
There is an increased chance just in general of a respiratory infection, a number of respiratory infection in this time of the year.
It's the holiday season and people across the U.S. will be gathering with their family and friends to celebrate. But with holiday parties comes close contact, which can become a health risk as we are in the cold and flu season. Dr. Armando Paez with Bay State Health told 22 News that there are many ways to prevent the spread of respiratory infections. One way is to get up to date with your vaccines.
Practicing good hand hygiene and clean frequently most commonly touched surfaces like doorknobs, keyboards may help in spreading infection.
And if you live with someone who is at high risk, Dr. Paez says protection from the flu and other viruses comes down to wearing a mask and social distancing in public areas that have poor ventilation. The CDC reports that cold and flu season normally peaks between December and February. And while people are at risk of getting RSV, COVID, and the flu during this time of year, medical experts say the symptoms are hard to differentiate.
They have really overlapping symptoms, but RSV most commonly affect more severely younger children and the older adults.
Some of these symptoms can sometimes include fever, cough, and shortness of breath. So if you're experiencing these symptoms, Dr. Paez says you should avoid being around others, take a test, and reach out to your doctor if your symptoms get worse. Working for you, Kiara Smith, 22 News.